Nyabuga from the Department of Biological Sciences at your university, that is the University of Embu. And perhaps before we get into today's topic, it might be worth to just have a recap or to have a review of what we learned last week. And that lecture was given by Dr. Daniel Ndiwa, who is also a member of the Department of Biological Sciences at your university, at the University of Embu. And perhaps before we get into today's topic, sorry, I had to mute something. So anyway, so we'll start by reviewing what we learned last week. And in last week's lecture taught by Dr. Daniel Ndiwa, we did see that HIV, that is a human immunodeficiency virus, it infects white blood cells, specifically CD4 cells. And these are the ones that are involved in the human immune system. And so over time, when the cells, the CD4 cells are infected, they are killed. And they are therefore not able to detect, they're not able to recognize, and they're not able to fight some types of infections. And so what then happens, it leads to development of opportunistic infections. And if you fast forward on this opportunistic infections, then you have the acquired immune deficiency syndrome, which then is the AIDS. We also did see from that lecture that HIV, it's an RNA retrovirus, and it is thought to have originated from chimpanzees and in the 1920s. It is thought. It's very important that we note that word. It is thought. And so then what happens is that in 1981 or so, there is some cases of some lung infection in the US. And so then the history of this virus, the human immunodeficiency virus, starts then from the 1980s onwards. And so we did see that there were quite a number of developments all the way from 1983, where the doctors in France first called this virus as a lymphadenopathy associated virus, or LAV, and then other things went on, and in 1986 it was thought that all other nomenclature be put under one virus, which is then the human immunodeficiency virus. And in the year 1990 or so, some of the first drugs were already identified, and so other events took place. And here we are in 2021, still talking about the pandemic. And Dr. Ndiwa also then took us through a number of theories that have been brought forward by different persons to try and explain the origin of HIV/AIDS. And he did mention about the mysterious origin, that is about the comet passing through the earth, and then of course spreading this virus. There were some religious theories which were that HIV is through God's wrath or witchcraft, the monkey origin theory, the polio vaccine theory, and so on and so forth. And so then, having done that, today we will be talking about HIV and AIDS epidemiology. HIV and AIDS epidemiology. So maybe, just to start, I will start by asking you learners. I wish you could speak to me, but it seems like maybe you have to type in the public chat. So what in your understanding is epidemiology? We'll be looking at epidemiology. So from your understanding, what exactly is epidemiology? And that from what you might be thinking what epidemiology is, how do you perceive this information on epidemiology to be helpful to the society? I'm watching your YouTube. Maybe I can see anyone typing in. What is epidemiology to you, and how is the information that is given in epidemiology helpful to society? Maybe we can start there. I'm watching your YouTube to see what you guys are doing. What is epidemiology to you? Anyone? What is epidemiology? How is that information that is shared in epidemiology helpful to you and the society? I see William Johnny is typing, is the scientific study of epidemics. You're right. And yeah, the scientific study of epidemics. And I can see Kennedy saying the study of epidemics or diseases. All right, good. Cyprian Odunga is the study of world pandemic. Mutinda is the study of epidemics, scientific study of epidemics. Yes, just to read a few from the public chat. Epidemiology is how severe a disease can be, study of epidemics. So yes, I can see that Brian Omondi, the study of distribution, spread, disease and its effects. I think Brian Omondi is doing very, very well. Yes, study of epidemics and diseases. Yes, epidemiology is a study. It's a scientific study. Yes, and we agree with that. All right. So let's see how you guys are all faring. Thank you very much for contributing to that. So epidemiology, as a definition, is the study of the distribution and determinants of health-related states or events in human populations, and the application of this study to the prevention and control of health problems. I've highlighted some words there. The distribution, the determinants of those health-related states, and then application of this study to the prevention and control of the health problems. In relation to HIV and AIDS, which is our topic or which is our course, then we will be looking at how is the distribution of HIV in the world, in Africa, in Kenya. What are the determinants of that distribution that we will be looking at? And the question that then we'll be leaving with you, how do you think that information on the distribution, the determinants, can help us as a society, can help you as an individual, can help you as a student to manage the pandemic? So this is the essence. So how do you as a person, how do you as a student contribute to the prevention and the control of the health problems? So that should be the bigger picture for you as students. So the study of the distribution of health-related states or events, it certainly involves identifying the frequency and the pattern of the public health problem. And in our case, we are talking about the HIV. So we have to identify the frequency, the patterns, and of the HIV within the populations, world populations, African populations, Kenyan populations. And then, of course, the frequency here refers to the number of health-related states or events and their relationship to the size of the population. So at the end of this course, so that you can gauge yourself, is that you should be able to describe the distribution of HIV globally in Africa and in Kenya, and you should be able to establish or determine the factors that explain the observed distribution of the HIV in the world, in Africa, and in Kenya. In this study, of course, I've used different sources, and because then these numbers change from time to time, and so it is very important that we try to mention what period exactly are we talking about. So in the global, in the world status, HIV status, and in the data from 2019, that's about 2 years ago, there was an estimated 38 million people living with HIV. 38 million people in the world, an estimated 38 million people. Yes, that's perhaps more than half the Kenyan population, if not 2/3 already of the Kenyan population, if you see what we are talking about. So an estimated 38 million people are living with HIV. And this population, unfortunately, it includes about 1.8 million children. And these are persons between the age of 0 and 14 years. So children are persons who are considered, who are in terms of age between 0 and 14 years old. So we have about 1.8 million. And that, of course, then takes you back to the first lecture when we did see the modes of transmission of HIV. And that this adult population, 38 million, is then about 0.7%, 0.7. So we are talking about an approximate 1 person out of every 100 persons. So 1 person out of about 100 persons is living with HIV. So when you look at the population of the University of Embu, yes, then you can tell perhaps how many persons could be among us from these estimates of the world population. And then around 7.1 million people, that is in the world, and that's about 19%, of course, of these, people do not know that they have the virus. When you have 7.1 million people in the world not knowing that they have a virus, this course on CCS 103 becomes very important, because then is to bring awareness to you that yes, among us, there are people who actually do not know they have the virus. So it's very important that we bring this awareness to you. And since the start of the epidemic, if you remember the history in last week's lecture in 1984, an estimated 75.7 million people have become infected, and an estimate of 32.7 million people have died from AIDS-related illnesses. Yes, what we talked about, the acquired immunodeficiency syndrome. Yes, the opportunistic infection. So approximately 32.7 million people have died from AIDS-related illnesses. And that is data up to 2019. And in 2019, about 690, approximately 700,000 people in that year alone, in 2019, died of these AIDS-related illnesses. But when we look across the board from when perhaps the pandemic started and the values, for example, in 2004 or in 2010, where we had about 1.4 million people, this number you can see has reduced. It has reduced by more than 40%. In 2004, there were about 1.7 million deaths. In 2010, there were about 1.4 million deaths. But in 2019, we are talking about 690,000. So again, in this case, that's why we urge you as young persons in the society, maybe you can help us even reduce these numbers further. Yes, so you have a role to play in reducing these numbers. The vast majority of people living with HIV, unfortunately, they reside in low and middle income countries. Low and middle income countries. And these are countries that we are talking of, they live, persons having or earning less than $2 a day. Yeah, the low and middle income countries. And so it is estimated that 4,500 people contract HIV every day. Yes, 4,500 people contract HIV every day in the world. And of these, about 59%, they live in sub-Saharan Africa. And that is where we Kenyans are. We are in the sub-Saharan Africa. And so we are in these statistics. So when you look of approximately 60% of the 4,500 people who contract HIV every day, yes, we are here. And the more the reason that we should all be extremely careful East and Southern Africa remains the region most affected by HIV in the world, and it has 20.7 million people who are living with HIV. And in 2019, it is estimated that there were about 730 new HIV infections. And that's quite a huge number in East and Southern Africa. And in terms of new infections, in 2018 and 2019, the number of infections, it remained static. And the data that we're getting is that there were about 1.7 million people during this year. And in 2017, there were about 1.8 million people. So there seems to be a small change, an insignificant drop, say, for example, from 1.8 million to 1.7. So we are talking about over 100,000 people. Well, that's quite a huge number, but it is quite just a small drop. So in the past 8 years, so talking of 2018, from 2020 to 2010, the global new infections, they have declined. So in 2010, it was estimated that there was 2.1 million people. In 1997, there was about 2.9 million. And so these numbers have then seemingly been reducing to where we are now in 2019, when we were talking about 1.7 million, all the way from 2.9 to 2.1 to 1.7. So these new infections among children globally have also declined. Yes, we did see that there is also infections among children, and these numbers seem to be also declining by over 40%. And that is, for example, from 280,000 in 2010 to 160 in 2018, and about 150,000 in 2019. In 2019, again, 62% of new adult HIV in global new infections globally were among key affected populations and their partners. And so these populations that we are talking about include the sex workers, persons who earn through engaging in sexual activities, people who inject drugs, prisoners, transgender people, and these are people who, in their perception, from how they perceive themselves or from how they take themselves different from the sex in which they were given at birth. So there are people who, for example, at birth, they were born male, but the way they view their bodies now could be that they look at themselves as female, or there are persons who are born female, but the way they perceive themselves as male. Transgender people. Then you have gay men and other men who have sex with men. So you have gay men, of course, men who have relationships with other men, and then of course there are men who have sex with men, but they also have sex with females. Yes, so men who have sex with men. So all these kind of groups of people seem to show quite a high number of infections of HIV. Sorry, it seems like my images are disappearing. Maybe I try to see whether I can upload a different presentation. Sorry. Just a second, it's coming. Because I realize that I'm losing some images, so that you can appreciate that. Yes, just to go back, when we did talk about 4,500 people contracting HIV/AIDS every day, 20 million people in East and South Africa living with HIV. So from this figure, this is some of the figures that we're missing, is that you can see when you look across the world, for example, these are the number of persons, and you can see that in 2019, we have in East and Southern Africa having about 20.7 million people living with HIV/AIDS. And that is then followed by West and Central Africa. And so these are the low and middle income earning countries, the Asia Pacific. Yeah, so you have the West and Central Africa, East and Southern Africa, 20.7, which is really huge, 20.7 compared to 4.7 in West and Central Africa. Then you have about 4.8 million in Asia Pacific, and then low numbers in West and Central Europe, North Americas, 2.1 in Latin America, 1.7 Caribbean, having about 330,000, and the Middle East and North Africa. So there could be a number of factors that explain this kind of numbers. Yes, but I mean, you can see that we have key populations from the sex workers, men who have sex with other men, the gay men, the people who inject drugs, and this kind of, and of course, our cultures and our behaviors will be playing a role. But the bottom line is that the huge number of infections is seen, or people living with HIV/AIDS is East and Southern Africa is the leading with about 2.7. And of course, you have the list in the Middle East and North Africa, which has about 240,000. And so this new infection, I think we've looked at this slide. So in 2018, 2019, the numbers were about 1.7, which was a small drop from 1.8 in 2017. But in 8 years, there has been some decline of infections. And in children, there has also been a decline from 218 in 2010 to about 150 in 2019. And then we did see these numbers. So the sex workers, the people who inject drugs, the prisoners, transgender people, gay men and other men who have sex seem to be also having quite high infection rates among them. And yes, so these are the values as a figure, so that you can see that here, if we were to start below here, so that then we have the transgender people, about 2%. I mean, remember these transgender people, they are a very small population within the populations. So having about 2% is quite a huge number. So that then you have 23% in men who have sex with men, so you have 23%. Then 10% people who inject drugs. So 10 persons out of every 100 of people who inject drugs, they're living with HIV. With the sex workers, 8 persons out of every 100, they have that. And then, of course, the rest of the population, yeah, people who do not fall among these groups, yeah, are 38%. And of course, then you have clients of sex workers and sex partners of other populations. So you might have a wife at home, you might have a husband at home, but you engage in other activities. Then, of course, you're bringing HIV to your partners and things like this. So it's very important that we look at these numbers and understand then how can this information be used to manage HIV in these groups. So the reduction in new HIV infections has been strongest in the region most affected by HIV, and that is the East and Southern Africa. So the reduction has actually been huge in East and South Africa, and whereby the new infections have reduced by 38% since 2010. And in West and Central Africa, there has been about 25% reduction. 29% reduction in the Caribbean, 12% in Asia, and 15% in West and Central. So you can see that most regions, these regions that we've seen previously here, they seem to be showing reduction, but it's not all regions actually are showing a reduction. Some regions are actually showing an increase. So in Eastern Europe and Central Asia, the annual number of new HIV has actually risen by 72%. And that's quite a huge number. When other regions, the numbers are decreasing, in certain regions, the numbers are increasing. And there has also been an increase by 22% in the Middle East and North Africa, and by 21% in Latin American over the same period. And from these informations, it has also been noted that politics plays a key role in, for example, these numbers, where when you have presidents coming in and using voodoo sort of medication, or telling the people that they have medications that are not proven scientifically to manage HIV and AIDS, and you have illiterate populations, or you have certain cultures that allow people to engage in whatever activities that they wish, then they are contributing to some of this increase. And of course, then awareness is very, very important. So from a pictorial perspective, so you can see that when we look at Latin America, for example, there has been an increase by about 21%. And that is, we're talking from 2010 to 2019. In the Caribbean, there has been a reduction by 29%. In the North America, there's a reduction by about 15%. In the East and Southern Africa, where we say there is huge, then there's also a huge reduction of 38%. In West and Central Africa, there's a reduction by 25%. In the Middle East, where we did see there is an increase, there is an increase by 22%. And of course, the East Europe and Central Asia, where you have an increase of 72%, but in Asia Pacific, there is a reduction. So these two regions, form an important part. So why is there an increase while the rest of the world seems to be, rather the Latin America, the Middle East, and the East Europe and Central Asia, they seem to be having an increase while the rest of the world seems to be dropping. So that forms quite an interesting discussion. And I think this should form part of your group discussion. So you can look at this figure after and try to explain why you think these numbers, or you can read through the web to explain why these numbers seems to be increasing while the rest of the world seems to be, the number seems to be dropping. Young women, and maybe the young women in this class should be listening carefully. Young women are especially at risk, with around 5,500 new infections each week among young people. And these are the ones aged between 15 and 24. And I'm sure that the majority of the young women in this class fall in this age group. So among young people aged between 15 and 24 occurring in this group. So young women, please take care. In sub-Saharan Africa, young women accounted for 1 in 4 new infections. So do not be part of these statistics, the young women. Yes, as you can see, they account for 1 in 4 new infections in 2019. So the young women are twice as likely to be living with HIV compared to men in the same age group. So when you look at this age group, 15 to 24, the young women are twice likely to be living with HIV. So again, also the young men, be careful, do not be then part of these statistics. The number of people receiving treatment, in terms of treatment, number of people receiving treatment, HIV, it has increased dramatically in the recent years. And that is mainly in the resource poor countries. And so this figure just gives us the numbers from the year 2000 to the year 2019. So the yellow, I don't know whether it appears yellow or orange in your screen, is the persons who are living with HIV. So this color, the persons who are living with HIV. And then you see some other color that looks like green, bluish, maybe in your screen. These are the people who are receiving treatment. So that then in the year 2000, we are talking about 24 million people living with HIV, but a very small fraction of about 770. That's about 3%, I think. So about 3%, 770, 24, 3% of persons who are living with HIV were accessing treatment. Fortunately, over time, these numbers seems to be increasing, so that in 2005, when you had about 27.3 million, 2 million people were receiving a treatment. In 2010, when there were about 30.7 million people living with HIV, there was 7.8, and you can see these numbers are increasing over time. So that then we are talking about of 38 million in 2019. You realize that more than 50%, or something close to 60% of persons who are living with HIV/AIDS were actually accessing treatment, and that's commendable statistics. So we're talking of 2019, we have about 67% of all people living with HIV. So these 25.4 are about 67% of these people here, then they were accessing. And that means that 59, or statistics then show that 59% were virally suppressed, So the idea is that when persons receive treatment, of course, we know that AIDS cannot be cured. But if you reduce the viral load, in an organism, then the possibility to transmitting it to another person becomes low. So that then 67% of the people are accessing treatment, and it is noted that 59% of those persons, their viral load was suppressed. So that then in 2019, we are talking of 81% of persons, they were aware of their HIV status. And of these, 82%, they were receiving treatment. So you have 81% people are aware that they are HIV positive, and 82% they were receiving treatment, and 59% they had yes, 88% of those persons, which is about 59% of that total population of persons living with HIV, then their viral load was suppressed. The figure or the illustration. And of course, significant progress has been made in the prevention of mother. Remember, we did see that the numbers of child infections they have been declining over time. Although there's still kids who are infected, but there has been significant progress made in the prevention of mother-to-child transmission, the mother-to-child. So that 82% in 2018 and 85% in 2019 of all pregnant and breastfeeding women living with HIV, they had access to treatment and to prevent transmitting the HIV to their babies. And so that shows that then this is actually a very good increase from about 45% in 2010 to 45% in 2010, when 45% of the pregnant and breastfeeding women were receiving antiretroviral drugs. Yes, so there has been an increase in preventing from mother to child transmission. I can pause for questions. Do we have any questions? I pause for questions. Questions? Let's avoid stigmatization. Yes, someone is asking that I can share the slides in e-learning. Yes, I will post them in the e-learning after the class, or at maybe towards the end of the day. I will try to have them uploaded. I will do so. Questions, comments? Kuna mtu anauliza class ilianza saa ngapi? Class huwa inaanza saa 1 kamili. Yes, I need to announce. Someone is asking, do we meet after this? Please, an announcement. For those ones whose class is in CH, for those ones whose class in CH, Dr. Daniel Ndiwa requested that I announce to you that there will be a meeting in CH. Actually, the meeting is starting at 8. There is a university meeting starting at 8 in CH. So he says the class will not be able to take place today, but he will communicate to you when next you will meet. So please, those ones who are meeting in CH, take note of that CH will be having a meeting and you will not be able to meet today. But he will communicate, and hopefully next week you will be able to meet him. But he will communicate. Keep in touch with him. Someone is asking about transgender people. Can someone tell him what we spoke about transgender people? Someone is asking why is that ladies are at high HIV, high risk of contracting HIV. Just quickly, transgender persons, these are persons who have a different perception of their gender. They have a different perception of their gender from the gender that they were given at birth. At birth, you might have been born with a penis, and then, of course, given your gender as a boy or as male. But then the body in which you are, you don't feel like you're a boy. You feel like you're a girl. And so you consider your gender to be a girl. Or there are persons who are born and at birth identify as female. But they do not, when they feel in their bodies, they don't feel like they are female. They feel like they're male. And I think you've heard of these kind of cases. Yes, why are women, young women? Yes, I think in the local scenario, we know that, for example, women could be coerced into sex. In regions where you have wars and you have chaos, women are used as tools of war. Yes, there is raping that goes on, and they are subjected to sex without their consent and things like this. Yes. So if you look among yourselves, you look among the populations in Kenya, I think you should be able to explain somewhat why young girls are susceptible to contracting HIV and AIDS. So please take care of yourselves. Mohammed Kane is asking, those virally suppressed, are they cured? As it is right now, there is no cure for HIV. What it means is that when you have a low viral load, then it means that the rate at which your CD4 cells or the rate at which your immunity is affected is also then low. So that then your viral load is low, your immune system is somewhat improved, and it is able to manage some of the opportunistic infections. But you are not entirely cured. But it means that your body is able to at least gather some energy or gather the immune system it requires to fight off some infections. That's basically what it means. I'm not sure what the question is. What are the 4 immune cells that host CD4 receptors? I'm not sure I understand that question. Maybe we can discuss that in class. Someone is asking, all this information can be tested in exams. Yes. I think that gays are not the same to transgender. That's true. Gay is not the same as gender. Gay is not the same as gender. Gay persons, in females, there is maybe what in females it's called lesbians, right? But as I say, transgender, you can be born a male, but in your body you feel you are female. It's not gay. You're not gay at all. So there's a big difference between gay and being transgender. Okay, we continue with class. All right, HIV and AIDS in East and Southern Africa. East and Southern Africa. And that is from this figure. This is the map that we are talking about. This is the region that is considered East and Southern Africa. So Kenya, of course, is in between there, coming all the way down from Ethiopia down to countries in Southern Africa. So East and Southern Africa is home to around 6.2% of the world's population. So this region only, it hosts 6.2% of the world's population. But over half of that are living with HIV in the world. So if we are talking of 38 million persons in 2019 living with HIV, we noticed that over 20%, rather over 20 million persons, over 20 million persons are living in this region, the East and Southern Africa. So you realize we are in a region which is where we have a majority of persons living with HIV and AIDS. So in 2018, there were 800,000 new infections, and that's about 41% of the global total. South Africa by itself, it accounted for more than a quarter. So 800,000. South Africa alone had 240,000 of the region's new infection. And there are other countries, and those other countries, we're talking of Mozambique, Tanzania, Uganda, Zambia, and Kenya. That's where we are. Then, of course, there's Malawi and Zimbabwe. Yes, some of their countries that also had huge numbers of infections. Kenya, we are talking about 46,000 persons infected in 2018 alone. So overall, new infections in the regions, they have declined by 28% since 2010. So since 2010, there has been a decline. But also the number that died from HIV, AIDS-related illnesses is also quite high. So that you're talking of 310,000 people dying of AIDS-related illnesses in 2018. But fair enough is that that number has somewhat declined. From by about 44% from 2010. In 2018, 85% of people living with HIV were aware of their status. So that's really good. And we think that then AIDS awareness is really working, because then once people are aware that they can go and test for HIV, they can know their status, they can manage it, that's very good. So that then 85%, so about 9 persons, every 10 persons, 9 out of 10 persons, they knew their status. And as about 8 persons out of those 9 persons were then on treatment. And that is an equivalent of about 67% of people living with HIV in the region, the East and Southern Africa. And that then 67% they were receiving treatment. 87 of those they had achieved a viral suppression, so their probability of passing it to another person is also low. So you can see the benefits of knowing your status, getting treatment, and of course having a viral suppression, and of course living with the condition positively. So again, this is just a number, so that 87% they were aware of their HIV status, so that then 83% of these 87 they were on HIV treatment, and that is, of course, that's about 72% of all people living with HIV, and that 90% of this 83% they were virally suppressed, and that is an equivalent of 65 of all people living with HIV having their viral load suppressed. East and Southern Africa HIV is driven by sexual transmission. That's very important to note, that the epidemic in East and Southern Africa is mainly, it's not only through sexual, but it is mainly sexual transmission. And it is generalized in the population, so that the infection is generalized in the population, meaning it affects the population as a whole, all the way from kids to very old persons, the entire population. Persons who do not perhaps engage in dangerous activities, they will somehow contract it. So it's driven by sexual transmission, and it's generalized, meaning it affects the population as a whole. However, certain groups, they show high HIV prevalence, and these groups include the sex workers, men who have sex with men, and these two groups, they show a significantly higher, while we're saying as a population as a whole, it is affected, but there are persons, the sex workers, the men who have sex with men, yes, they show a high HIV prevalence. As an example, in 2018, talking about the East and Southern Africa region, Lesotho, it reported, and Lesotho is a very small country, it reported HIV prevalence among the general population as 23.6%. So we are talking about 23 persons in every 100 persons having HIV. And a survey in 2014, it shows prevalence is even higher among the sex workers. Yes, so these are persons who earn through engaging in sexual activities. And so you can see that it was high in 72% among the sex workers, and men who have sex with men in 33 persons out of every 100. So this is a very high prevalence. Yes. So we are not questioning your sexual orientation, but we are telling you that if you're a sex worker and if you're a man having sex with another man, then the possibility of you contracting the virus is quite high, 72, or remember that 33 persons out of 100 men, then chances are that 33 men will be having the virus. Just as a figure to illustrate again how the numbers are, or the distribution of new HIV infections among population groups, so that then you see the rest of the population is down here. There is about 9%. That's the clients of sex workers and other sexual partners. You have the gay men, about 6%, and 2% people who inject drugs, and 4% for the sex workers. Let's come down to Kenya. Yes, so we've seen the global numbers. We have seen the numbers in Africa, with a focus on East and Southern Africa. And now we look at Kenya. And from last week's lecture, we learned that the first case of HIV in Kenya was detected in 1984. Maybe most of you were not born then, but since most of you, I think, were born in 1999 or so, 1998, 1999, 2000, yes, that's quite 16 or so years from then. But a few years before you were born, in 1996, 10% of Kenyans were living with HIV. So 10, or about 11 out of every 100 persons in Kenya, Kenyans, they were living with HIV. Fortunately, that prevalence has reduced since then, and now in 2015, the data from 2015, it shows that there are about 6 out of every, so out of every 100 to about 6 out of every 100 persons then had HIV in 2015. But when you look at it from the relative to other parts of the world, Kenya has the third largest HIV epidemic in the world, with 1.6 million people living with HIV in 2018. So in 2018, Kenya had the third largest HIV epidemic. And in 2018, the data is that 25,000 people died from AIDS-related illnesses. 25,000. And fortunately, that the death rate has declined steadily from 64,000 in 2010. So you can see 2010, 64,000, 2018, 25,000. So that number is declining, and hopefully that number can continue to decline even further with the availability of medication and good behaviors or behaviors that don't expose us to HIV. In 2016, 64% of people living with HIV were on treatment. We're talking of Kenya. 2016, 64% of people living with HIV were on treatment, 51% of whom were virally suppressed. And I think you've watched TV, you've seen cases of persons who are saying they've come out to say they're HIV positive, they're taking medication, and they're living a normal life. And Kenya's HIV epidemic is driven by sexual transmission. It is driven mainly by sexual transmission, and it is again generalized. It means that it affects all sections of the population, including children, young people, adults, women, and men, all populations or all groups. In terms of geographic location, actually from the Kenyan data is that the distribution of HIV is affected by the geography. And data from the 2014 report shows that 65% of all new infections, they occurred in 9 out of the country's 47 counties. And that is mainly in this region, the West Coast region. The West Coast region seems to be having a high HIV prevalence, the West Coast region. Yes, talking of Siaya, Kisumu, the Nyamira, the Kisii, those regions had the highest. Of course, there are certain regions in the coast of Kenya, parts of Nairobi, Kiambu areas, they also showed very high, but most of the counties then in this West Coast region seems to be highly affected. And you can see this where you have this color, which is very intense, and these are the regions we are looking at here. Again, among adults only, so you can see again the regions where the HIV is again on the western part of Kenya seems to be having high prevalence of HIV. In terms of tables, you can see that Homa Bay, for example, is leading. You have Kisumu, you have Siaya, Kilgoris, Kisii, Nakuru, Nairobi, Turkana, Kiambu, Nyamira. This is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So top 10 counties, Homa Bay leading, yes? And that is the data from 2014, yes? So you can see Homa Bay was leading, Nyamira having about taking position 10. And of course, you have counties like Wajir, Vihiga, Tana River, Lamu, I think this is Busia, Marsabit, Bungoma having low numbers, yes, by counties. Again, children, again, you see that still in the West Coast part. And in terms of tables, again, you can see Homa Bay, Kisumu, Migori, Siaya, Kisii, Nyamira, Nairobi, Nakuru, Kakamega, Mombasa, topping in terms of number of children, that is ages of 0 to 14 years old, So you can see they are leading, and of course you have regions that are very low numbers for children. Yes, so it's very important that we know where HIV is high in Kenya. So maybe then we can also understand what our cultures, how do our behaviors play in terms of new HIV infections. So the total number of adults living with HIV by county and those ones receiving antiretroviral drugs. So you can see from these values is that certain patterns where we have over more than 100,000. And then, of course, the adult coverage, this being green. So you can see some of the counties. Again, it seems like the same patterns where you have very high numbers of infections for adults. Then you also have those regions having also quite high. Of course, Marsabit comes in, but I mean, these were regions that were also having very low infection rates. But it means that the people in those in that county are also taking up antiretroviral drugs. So again, in terms of counties, okay, maybe I will try to improve this figure, but you can see that counties that are very like Mandera, Turkana, Samburu, Wajir, they have very low HIV prevalence, but the people are also accessing antiretroviral drugs, which is commendable. But I will improve on this slide and before posting it up. So just to narrow down, what are the groups that are most affected by HIV in Kenya? The groups that are affected by most affected by HIV. The first group is the sex workers. The sex workers. The sex workers have the highest reported HIV prevalence of any group in Kenya. And data from 2011, it estimates that 29.3. So we are talking about 29 persons out of every 100 of the female sex workers, they were living with HIV. And a study of 2015 of female sex workers in Nairobi found that around 1/3. So in Nairobi alone, more than 30% of the sex workers, more than 30% of the sex, close to 33% of the sex workers were actually living with HIV. That's in Nairobi alone. And a 2015 study, which is led by this organization, Global Network of People Living with HIV, it found Kenyan sex workers, they face heightened risk of violence with little or no protection from law enforcement. So that you have the sex workers, they will be on the streets, and they face violence from their customers or violence from whomever, and they have actually no protection from the law enforcement. And in this response, they say that all the respondents who were interviewed in this survey, they all stated that they had experienced rape. So they had experienced rape. All the sex workers interviewed, they said they had experienced rape. And that they, of course, had accessed post-rape medical care. But none of those persons, they had reported the incidents to the police for fear of being prosecuted for engaging in sex work. Yes, so some of the things that then explain why HIV is, for example, common in sex workers or even in young women. Yes, they will be raped, they will go for medication, but they might not involve the police. The second group is men who have sex with men, or MSM. HIV prevalence among men who have sex with men in Kenya is almost 3 times that among the general population. So men who have sex with men, they are 3 times likely to have HIV. And in 2010 estimates among these MSM is that there were 18.2%. So 18 out of every 100 persons among this group had HIV. And condom use among men who have sex with men has been rising, so that's at least good news. And in 2016, 80% of the men who had sex with men, they reported using a condom. And you can see this number was 855 in 2011. So they're from 2011, 55 to about 80% in 2016, some increase. Homosexuality is illegal in Kenya, and it carries a prison sentence. But we also have the social attitudes towards men who have sex with men, which leads to a high level of stigma, discrimination. And of course, we have other groups, the lesbians, the gay, the bisexual, the transgender. And with these social attitudes, stigmatization, so some of these persons do not really come out to state who they are or to even seek medications. And as a result, then you have a policy to address the HIV epidemic among Kenyan men who have sex has, of course, been lagged behind. When you have persons who cannot come out openly to state their status, then coming up with programs to address the HIV among these groups also becomes a challenge. The other group is the people who inject drugs, the people, so the third, so we have the sex workers, we have men who have sex with men, and the people, the third group is the people who inject drugs. And in 2011, an estimated 18, so 18 out of every 100 persons inject drugs. And these persons were living with HIV. So the majority of people who inject drugs, they are concentrated in regions such as Nairobi and Mombasa. And condom use among people who inject drugs is certainly increasing, at least that's what the surveys show. And of course, there is introduction of certain programs of harm reduction services. So whereby, for example, they are given syringes or they are given needles so that they do not have to share needles and things like this. So the introduction of harm reduction services in 2012, yes. And so that has also helped them to reduce the infection rates. Young people, and I think that's where most of you belong, young people. The fourth group that is most affected by HIV is the young people. And we are talking of more than half, that is 51% of all new infections in Kenya in 2015. They occurred among adolescents and young people. And we are talking of your age group, 15 to 24 years. And from this is that young women are almost twice likely to acquire HIV when compared to their male counterparts. And in comparison, young men, they accounted for 16% of all new HIV. So please, the young people, you are in an age group where you might be the persons affected. So it's our urge, it is our desire that you take note of this and take care. So a number of factors contribute to increasing rate of HIV among young people, including incorrect perception of HIV risk. So that's why it's important that you get a correct perception of what the risk of HIV is. And that the young people, they are having unprotected sexual intercourse, and of course, under the influence of alcohol and drugs. Yes, and so, having alcohol once in a while is okay. Drugs, no, maybe. But then once you engage in these kind of things, then you have unprotected sex. And that could lead you to contracting HIV. So young people, we urge you to please take care. And there's, of course, other things like forced sex and sexual violence also increase young people's vulnerability to HIV. And this is particularly affects young Kenyan women. Yes, young Kenyan women. Women, yes, we will seduce you, but before you know it, we are saying what you need to do. So we, young women, please be careful. It is estimated that 33% of girls in Kenya have been raped by the time they reach the age of 18, with 22% of girls aged between 15 and 19 describing their first experience of sexual intercourse as forced. Girls 15 to 19, I think this is where you belong. Yes, your first sexual experience seems like it is forced. Yes, do not let this happen to you. And then, of course, you have women. Yes, from the young people, you again have women. So in 2016, women accounted for 910,000 of the 1.6 million people living with HIV in Kenya. And as in many parts of sub-Saharan Africa, women in Kenya, they face discrimination in terms of access to education. Yes, most of our cultures, most of our communities is that the girl child stays at home, does not acquire education, while the boy child, but maybe these ones are changing now. There is the employment and there is healthcare. So as a result, men often dominate, for example, the sexual relationships with women, not always able to practice safer sex, even when they know the risks. So, for example, in 2014, 35% of adult women aged between these 15 who were or had not been married had experienced spousal violence. And we know this in our communities. Yes. And then, of course, that exposes the women more to HIV. So quickly to review today's lecture. We have seen the numbers in the world in terms of HIV prevalence. We have seen the numbers in terms of persons acquiring treatment. We have seen that the treatments and this number, when persons acquire treatment, the viral load is decreased, and we've seen these numbers. We have brought that information down to East and Southern Africa and to Kenya. And in Kenya, we have seen the populations that are mostly at risk. Yes, from sex workers to men who have sex with men, to young persons, to women. And so just to review today's class, I'm posing some questions for you, which you should be able to discuss and post them in the e-learning. And one of the questions is, which group of persons are vulnerable to HIV infection in Kenya? And how could then this information, yes, be useful in HIV control? And how does the information on the spread of HIV in the world and Kenya help you as a person? I want you guys to think about this and make some summaries and have them in the we have when you go to e-learning to topic 2, you will notice that there is a discussion forum. I want you guys to post your discussions there. Yes, I will post this presentation. Someone has he's raised that I did not record this class. Unfortunately, if I did not do so, then we will have to find a way of at least. But I will post this presentation, and you're free to contact me at any given time. Okay, maybe I look at quickly at your discussions, because I need to go for a meeting now. Okay, any questions quickly before I head for a meeting? So the ones whom I'm meeting in LT03, Dr. Mugweru will stand in for me. He will meet you briefly. So please go to the lecture hall at 9. Be there by 8:30. From 8:30 onwards, at 9 you're there so that you can meet him and you can have a discussion with him. But we will meet you next week. Someone is saying, is the school's VCT center accessible? Yes, please go to the clinic and they will give you directions. How can we post it in the e-learning? I suggest you contact ICT. They will be able to help you. Okay, guys, I wish you a wonderful day ahead. I really need to run for a meeting, and it was nice that you could join the meeting. It is nice that you can engage me in the discussion forum, and I hope that you had an enjoyable class. I wish you all a wonderful day. Goodbye now.